first startup is presented by Dr. Pankaj Jain. Pankaj, go ahead.
Thank you very much for giving me the opportunity here. I'm here sitting in the studio with Dr. Oli, and let me just share the screen here. Can you see my screen?
Yes.
I'm Dr. Jain. I'm a pediatric cardiologist by training, and I'm excited to be here in San Francisco. Just to start with, so I'm going to talk about Rovicare, which is a care coordination platform. And our really mission and vision is to inform and engage all the stakeholders to seamlessly accomplish transition of care from any device, anytime. So we started this journey of Rovicare. My co-founder and partner is a savvy technologist. So we got together, and Rovicare actually originated from personal experiences when he had his second child. So he had a tough time discharging his wife because of lack of care coordination and communication. He saw me in a investor meet, and we got together. He challenges me, and I challenged him, and we started this journey of Rovicare. What we are solving, as we know, care coordination is broken, and because of this care coordination issues, there are many problems which can lead to delayed discharges, heavy increased rate of readmission. There are so many care gaps, and there's a lot of clerical work, and patient satisfaction is very poor, which leads to almost cost healthcare almost $250 billion every year. We talked about a little bit of mission and vision, where we want to become a trusted healthcare SaaS leader by creating a platform that engages and connect all the stakeholders in patient care. The wellness, the journey of wellness of the patients, starts from not in a linear order, but it can start from anywhere, and there are multiple providers involved in the patient journey, whether it's a hospital, skilled nursing facilities, outpatient departments, mobile providers. And if you see these pathways, when the patient moves from any one setting to another setting, they are kind of broken. So what we do is Rovicare pave those pathways to make that care transition seamless. Next slide. Care transition is a very complex process. On the left side, if you see origin, and on the right side is a destination. So origin could be a destination, or destination could be origin. So origin could be, any skilled nursing facility, hospital, outpatient care, ambulatory care. And it usually involves four steps, where there's a provider selection, there's a referral process, there's a transport, and there's and care team coordination. So it's a complex process, a lot of phone and faxes involved, and we try to smoothen that process. We create a little bit of animation. On the origin side, if you see their case managers, social workers, discharge planners, care navigators, they go back and forth with the patient and families. Hey, where do you want to go, and what is going on with care? If a patient is 70, elderly, their kids are outside of state or something, they connect with their kids, and then they talk to the destination. They have to fly sometime, or they have to reach and tour those destinations to make the decision. So again, the destination, again, they're going to talk to these discharge nurses and planners. Then comes the insurance, and you see, and there's a lot of back and forth between different players. Physician and clinics, they are not aware of what is happening to their patients when they're inpatient, and community and coaches, they don't know what is going on. So you see this slide is busy, very convoluted, a very complex process. So what we do is, Rovicare is a SaaS platform, cloud-based, and we try to connect all these stakeholders together. Value prop, you see, we reduce the clerical work, helping in preventing some readmission and helping in patient satisfaction. On the patient side, there is a real-time information we share with the patient and families, healthier outcomes. On the destination side, effective care transition, quick response, and we decrease the revenue leakage. And also, we made our platform in such a way that we try to create the marketplace for different type of providers. So whether it's a technology-based providers, whether they are ancillary service providers, the payers, or there are some social determinants, and also the medical facilities. So they can become partner with us, and whenever whatever patient needs, we try to do that care transition and fulfill the needs for the patient to get better. We do have some competition, in this space. Navi Health is one of them, which they do this referral automation. Zephrol is one, Patient Ping is one, Silverview is one. So when we started this journey, being in medicine, we did a lot of research and try to build up a product from which can do end-to-end care and transition of this patient smoothly. Key market segments, behavioral health, we already invaded that. Hospital and healthcare systems, skilled nursing facilities. We do have skilled nursing facilities on our platform. Health plans, we're getting a lot of traction from health plans. So 3 or 4 health plans, 2 are already using, 2 are under contract. Hospital at home and the outpatient, we're gonna roll out in outpatient world very soon. Market size is huge. Everybody knows that. Skilled nursing facilities and behavioral facilities, health plans. There's tons of opportunities. As we know, there's a huge need for care coordination in different segments. A revenue model, we charge a monthly subscription fees, and a skilled nursing facility is almost, we charge them $750, and because of the network effect, wherever the patient goes or whatever patient needs, like a home health or any DMEs, so they are also participating on Rovicare, and we are charging minimal fees for them. So almost $2,000 per nursing home per month. We can definitely make that money there. Behavioral facilities, we are charging up to like $2,000 per month. Health plans, we are doing PMPM model, and outpatient providers, we kept it very low pricing on that. Traction and recognition, we have 500 organizations on our platform. You see some marquee names here like Centene Corporation, Banner University Health Plan is using it on the insurance side. Then we have Arizona Complete Health is coming up. We have crisis teams in the behavioral side. We have some hospitals, psych hospitals, they are using our product. Our financial projections, we are almost up to the mark. We are reached halfway. Our plan is to go around 1 million ARR this year, and then our growth is like it is. As I said, it is organic growth going to happen between these different providers, the origin and destination. We're gonna plan. We're gonna be up to like get 4,000 providers by next year, which gonna take us to like 7 million ARR, and we'll continue to grow in this fashion. Case studies and press releases. But we do have some case studies where we have made an impact. On our website, we have 3 case studies where we proved how much money we are saving. Like we saved $40,000 for a nursing home. They can repurpose this skilled case managers to do some clinical work rather than doing clerical work. We also saved per discharge like 3 or 4 hours per person. There's a Banner Health News is there. We partnered with InnovatorMD, which is a psych space. They're providing a psychiatric services in a primary care. We partnered with them, and we also selected at Nashville Entrepreneur Center recently for their coaching and mentorship. We are trying to, we raised $3 million in the past, trying to raise another $2 million currently before we go to Series A. It's a bridge round. We're going to accomplish scale sales nationwide. We're gonna get some leaders and become number one in the category. Money gonna go mainly on the sales and marketing side, 40%. Technology is robust. Being my co-founder is a technologist, we kept it very lean. We're gonna keep it very lean. Exit strategy, we do have exit strategy. EMR payers or providers, other health tech companies and some private equity companies can definitely buy us out. This is our team. We have some marquee names here, and they are all. It's a mix of professionals, physicians, doctors, engineers. Key points are, it's a growth company. We have 250 customers across all segments. Expertise we have, strong sales pipeline we have, and we have customer acquisition via a network effect. Thank you very much. With this, I think I took exactly 10 minutes, so that's great, and open for any questions.
Okay, judges, let's go with Dana.
Well, thank you so much for the presentation. I'm curious that when you talk about it's a SaaS platform and cloud-based, are you providing any services? So are the care managers are with the client and you're providing them with technology to connect?
Yes, it is a pure SaaS platform. So we give them the platform, we train them, and then when implement, we have a very robust implementation, training and planning. So we can onboard these facilities in a week to two. And from there, their social worker, case managers, they're going to use our platform. So we are not providing any services, we are providing the technology.
Okay, and are you integrated with any of the EMRs today?
Yes, we are integrated with EMRs. So on that note, we are integrated with Point Care Click, which is a number one EMR for skilled nursing facilities. We are on their, marketplace. 100% integration. We are integrated with Cerner. We are integrated with other outpatient EMRs like Athena, NextGen, as well as with eClinical Work. We have also partnered with Redox Engine, and we also partnered with Commonwealth, where we can exchange medical records from 500 plus EMRs.
Great, thank you.
Vince?
So Pankaj, I really loved your presentation, right? From the concept evaluation to the customer base to the ARR. My question specific to you is, how do you evaluate your exit strategy?
Yeah, no, that's a great question. So to evaluate, the exit strategy events. So current market, if you see, and of course in the COVID times, definitely the evaluations have ramped up. But we are pretty modest in evaluation, and it looks like that the healthcare SaaS platforms, depending upon their ARR, we've been talking to some, VCs and all for funding. So everybody talks about day and night about ARR, and I think it is 10 to 15x where if you show your growth strategy and how you're growing, I guess 10 to 15x of your ARR.
Now your exit strategy has some baseline, or is hypothesis, or is something imagination, or some
so it's not really imagination, but I think yes, there's a hypothesis, and we did sit with a few of the CFOs and other market players to plan that exit strategy, and I think we came up, like the way we are growing, that's how we did our pro forma. And I don't know exactly if there is any name of that hypothesis or anything, or there is any other tool behind those exit strategy. I'm happy to learn from you, Vince.
Yeah, thank you, Dr. Jain.
Thank you.
All right, Dr. Doro.
I enjoyed the presentation, and you're addressing a need we all face every day in clinics, connecting our patients and helping them to transition to the care they need. I'm curious about some of the details. Who owns the data?
So yeah, data is cloud-based, definitely, and we are we have platformed on Microsoft Azure, and with all the securities and everything, it gets stored there. And so definitely we own the data. But for security and all that, we partnered with Microsoft Azure for the HIPAA compliance and all those security purposes.
Yes, I'm glad you're addressing the cybersecurity issues nowadays. So that's of the utmost
definitely,
importance.
we have a very, we have a very robust engineering team, and we made sure from day one, and we have a Fenimore Craig firm based in Arizona. They also have a cybersecurity expert, lawyers, and we definitely take their advice on each step.
And then I have a follow-up question: how to incorporate the AI-driven intake. So what does it actually mean for the patient?
So right now we share a link with the patient and families, and so it's not a 100% patient-facing app, but gradually it's a B2B business essentially, but we involve patient and family. They get notification, they get messages every time there is a change in their transition of care. And so that's how we are right now involved in the patient and family. We have also created a SOS button. Whenever they get discharged or moved, they can connect back to the last wherever they were last time. So if they have no medications, or if they need anything non-urgent, so they can reach to their facility.
And of course, being cost effective is one of the quintuple aims. So how do you then share these cost savings with the patient?
So as I said, definitely, I think for patients, what we are creating here is, of course, their satisfaction, which is very important. And again, there are some scoring systems done by hospitals where there is a HCAP scoring and all that, where patient involvement and patient satisfaction is very important. In terms of financial, of course, there is no cost sharing, and the patient and families, they don't have to pay anything to Rovicare. It's really free for them.
Wonderful. Thank you so much.
All right. Thank you very much.
Any questions from audience?
Let's stop that here because our time is up.
Thank you very much, everybody. Thank you. Appreciate it.